So we have Dr. Tejal Kanwar with us, founder of Clinetics and a gynecologist with good clinical experience and obviously experience in making young females as well as boys active. So we'll give the mic to her and we will start this. I think so. This is the topic which has got maximum registrations. We'll just see more people would in the meanwhile join in. So we'll start the session. Yes, Dr. Tejal, you can take it over from here.
Thank you so much, Mansi. I hope I'm audible to everyone here. And thank you so much for joining on a Saturday evening. So painful periods is not just a female problem. It is everyone's concern, especially coaches who are training female athletes and they want their female athletes to succeed. Painful periods have been all women, and even athletes are not spared, even if we know that exercise is supposed to reduce pain during periods. In fact, a lot of athletes do suffer from a lot of excruciating pain during their periods. So I'm glad that there are so many parents and coaches and physiotherapists and even nutritionists who have joined these sessions. We've received so many questions on the sheets, and it's quite amazing that so many people want to gain the right kind of knowledge. But I want to keep it as interactive as possible. You can keep putting your questions in the chat box and we can answer at the end of the session. So I have included most of the session's questions which were in the sheet as answers throughout the presentation. So we are talking today about painful periods. We are talking about the treatment, the management, the medical management, specifically of painful periods when it comes to the female athlete and during exercise. Mansi has already introduced me and I just have a passion to keep families, moms, parents, as well as kids healthy, happy, and fit. I also am a consultant on Ujas Foundation, which is an initiative by Aditya Birla Education Trust, as well as an expert on Simply Periods. You can find me on my LinkedIn handle as well as my Instagram handle if you want to reach out to me. Roses are red, violets are blue. Girls want to speak freely about periods, don't you? So I don't want to keep it too technical. Let's just be very simple and approach this problem in the simplest possible way and reduce all the myths and all the fear that is around painful periods, or dysmenorrhea is what we call it. So every time a woman has to go through a period, mahina, masik, pali, what you call it in Marathi, and mahavari, all women feel there is fear, there is apprehension, there is concern. Even if there is no pain, if they have a tournament, if they have a match, if they have to play, there is always concern whether there is pain or there is no pain. So always keep journaling about your thoughts is what I'm trying to show in this particular slide. Encourage your female athletes, encourage your daughters to write down their thoughts. What is it that they are feeling? It is so important to understand our daughters and our female athletes as to what are the feelings that they get during, what is the mood and how they want to approach. It is not just prescribing medicines. It is all about support. It is all about giving them the right information and thus managing the dysmenorrhea. So this is something that I want to start with. Y'all can just answer in the chat box, whoever is present, including you, Mansi. Let's go. Let's take a quiz. Is pain during periods normal? Is it normal to have pain during periods? Just say yes or no. I'm going to open. Yes, it is normal. Right. Pain throughout the cycle, the menstrual cycle of the 4 days, is that primary or secondary dysmenorrhea? I'm not sure if anyone here knows what is primary or secondary. So if it is throughout the cycle, is it called primary dysmenorrhea? Or if it is throughout the cycle, it is secondary dysmenorrhea. This is a tough one, but let's see if anyone is already knowing about this, so that I can judge the audience and see how much depth I need to go into. So pain during the entire menstrual cycle is definitely not normal, and it is connected to secondary dysmenorrhea, and which I will be explaining in the slides. Is the pulling feeling in the thighs normal during dysmenorrhea? Yes. The thigh pain is absolutely normal during dysmenorrhea. It is not just the lower abdominal pain. It is thigh pain, back pain, everything. Okay, this is a tricky question. Painful periods are the second leading cause of absenteeism in school. Yes or no? Let me check. Okay, so let me correct you all. It is the most leading cause of absenteeism in school. It is not the second. It is the first leading cause of absenteeism in school. Period pain. Full form of PMS, anyone? I think this is an easy one. The first come first. Yes, Gauri, absolutely, full marks. Pills which are given during painful periods, OC pills are given for period pain. Do they thin the uterine lining and thus reducing the period pain? I'm just trying to understand how much you all know. Okay. Does period pain reduce after marriage? Anyone? Don't know. Period pain and PMS, is it the same thing? Yes, it is not the same thing. Thank you so much for participating in this quick quiz. We'll jump right back into the slides. PMS and period pain are not at all the same. Premenstrual syndrome and period pain do overlap. There is definitely mood disorders which is seen along with the period pain, and they have the same causative factors, but they are also quite different. Sometimes PMS is present and there is no dysmenorrhea. It can happen. So these are just myths, and we need to straight get into the facts. Women are not hormonal and they are not tied to the mood. Dysmenorrhea is of two types. There are various names: painful periods, cramps, pain during periods due to the uterine contractions. Usually the secondary dysmenorrhea is due to a uterine problem, like a fibroid, like a growth around the uterus, inside the uterus, or outside the uterus, or infection. I'll come to that slide as well. And primary dysmenorrhea, which is very commonly seen in teenagers and adolescent girls, is without any cause or any kind of abnormality or any kind of tumor. There are two rare types of dysmenorrhea, which I've just mentioned. One is membranous, and the fourth one is ovarian dysmenorrhea. Now, you must be wondering that ovarian dysmenorrhea means, is it during ovulation? So ovarian dysmenorrhea is rare. At the time of ovulation, there may be a little bit of bleeding. Sometimes it's called the breakthrough bleeding because of the hormonal fluctuations. Around the 14th day, when the ovulation happens, there is a little bit of ovulation pain, which is the same thing as ovarian dysmenorrhea. There is a rare spasmodic dysmenorrhea, which is membranous dysmenorrhea. We all know that because of the shedding of the uterine lining, there is dysmenorrhea, which is the primary dysmenorrhea. But in membranous dysmenorrhea, what happens is the entire uterine lining, which is shed during periods, is shed altogether. Like it forms a blanket inside the uterus, and it tries to come out altogether like a sheet, like a blanket. And that is extremely painful. And that does not fall in the category of secondary dysmenorrhea because it's not really some kind of a fibroid or anything. It needs to be treated though, and it is seen in a lot of women and even young adolescents with irregular periods as well. So it is important. Please do not ignore this problem in females. Even if they are young, we need to rule out secondary causes of dysmenorrhea or membranous, and even so what are these reasons? What are the causes of the primary dysmenorrhea? It is the release of hormones. We know there is estrogen, we know there is progesterone. In the first half of the cycle, there is increase in the estrogen. When there is no pregnancy which happens, the estrogen and progesterone, which is going to drop down towards the end of the cycle, causes the menstrual cycle to start, and that causes the prostaglandin secretion, and that causes the pain. The second most important cause is the uterine contraction. The uterus contracts. The third important cause is when the blood vessels inside the uterus are constricting, or they are undergoing ischemia, or when there's constriction, it causes pain. And uterus is also has a cervix, which is the opening of inside the uterus, and that is also one of the reasons of primary dysmenorrhea, that is cervical pain. Now, if you can see this particular slide, these are the causes of secondary dysmenorrhea. These are all pathologies which we need to rule out. If any female athlete is having excruciating pain, we need to rule out fibroids and excessive hyperplasia of the endometrium. If you can see this particular illustration where the different types of uterus is seen, there is shapes are different. There are two horns of the uterus. The inside of the uterus is divided into different types of divisions, which is the septate uterus, subseptate uterus. These cause a lot of pain during periods, and these need to be ruled out by sonography or laparoscopy or any such investigative procedures. If you can see on this side, there are adhesions, fibroids, and all these cause what is called as, even endometriosis, what is called as secondary dysmenorrhea, which is due to fibroids and endometriosis, infections. It is also because of intrauterine devices like copper T, which is used for contraceptives, polyps, or cervical stenosis.
Tejal, just 1 minute. Can you just just revise it in Hindi? Is everyone comfortable here in English, or like any language barrier? Just the differences of primary and secondary dysmenorrhea in Hindi.
Sure. So so primary is without any cause, matlab there is no pathology, matlab koi tumor nahi hai ya koi infection nahi hai. Secondary mein infection hai, fibroid hai, there is a condition called endometriosis that is also the cause of secondary dysmenorrhea. So difference between primary and secondary mein there are other causes which need कोई मेडिकल ट्रीटमेंट चाहिए, किसी में सर्जिकल ट्रीटमेंट चाहिए, लेकिन प्राइमरी में कोई कॉज नहीं है. सिर्फ प्रोस्टाग्लैंडिन रिलीज या हार्मोन रिलीज की वजह से जो प्रोस्टाग्लैंडिन इंक्रीज होते हैं उसकी वजह से प्राइमरी डिस्मेनोरिया होता है, एंड वही है मेन कॉज ऑफ पेनफुल पीरियड्स या मासिक में बहुत पेन होना. यहाँ पे जो सिम्टम्स है, आई ट्राई टू मिक्स इट अप इन हिंदी एंड इंग्लिश. सो ये सारे सिम्टम्स में पेन, आगे के साइड पे लोअर एब्डोमेन पेन, बैक पेन, थाई पेन, प्यूबिक रीजन के ऊपर सुप्रा प्यूबिक पेन, वेरी फोकस्ड अराउंड द यूट्रस का जो एरिया है, रेडिएटिंग पेन, मतलब पेट से नीचे जाता है लेग्स की तरफ या बैक से नीचे जाता है लेग्स की तरफ. शार्प पेन भी हो सकता है, डल पेन भी हो सकता है. Specifically, primary dysmenorrhea में the pain starts about 12 to 24 hours, about 1 day prior. It may not start, but it may start just during the first day when the period starts also. It totally differs. But again, PMS और dysmenorrhea में वो overlap होता है. और nausea, weakness, diarrhea, giddiness, चक्कर आना ये भी काफी कॉमन है along with primary dysmenorrhea. Let me just see. Yeah, please put in the chat box if there are any questions. If you think that it's getting too technical, please do let me know in the chat box. Okay, anyone can relate to this picture? Yes or no? Yes. Anyone can relate to this picture? This diagram, this infographic is very, it really shows that torture that some women really go through. Extremely bad pain, बहुत ज्यादा pain. मतलब बेड से उठने को मन नहीं करता है. और बहुत सारे वर्किंग वुमेन में प्रॉब्लम देखने को मिलता है, टीचर्स में, बहुत सारी एथलीट्स में भी ये प्रॉब्लम दिखता है. जो एक्सरसाइज बहुत अच्छे से करती है उसमें भी ये प्रॉब्लम दिखता है कि इतना पेन, सिवियर पेन कि जस्ट कैन नॉट गेट आउट ऑफ बेड. So anybody can relate to picture number 2 sometimes. And the last picture is this, absolutely peaceful. Day 1 में थोड़ा सा symptoms and day 3 में mood is back to normal with a nice red heart. So does anyone relate to this? Absolutely normal period, कोई pain नहीं, absolutely happy period. Excellent, excellent. So there are all kinds of women and there is no single woman who is similar to the other. Everybody has their own individual issues and healthcare providers must listen. I see a lot of healthcare providers, doctors, they just ignore and just prescribe medicines. There is something which is missing is support, understanding and listening. And that should come when we are talking about female athletes. It must come from parents. It must come from our coaches. And this is something that is great what Simply Periods is doing and creating awareness. Every athlete, even at the top level, like for example, this long jump athlete, so many such athletes have gone through at the peak of their career or at the peak of their match, when they're just about to win the match, or they just suddenly get a cramp, suddenly. And in spite of taking pills and trying to postpone, pill लेके भी अगर postpone करते हैं period को तो भी cramp आ जाता है, तो क्या करेंगे? So इसमें medicine से ज़्यादा management, food, how we are sleeping, how we are stress free, वो सब important होता है. Abhi, we were discussing dysmenorrhea. Now PMDD, which is PMS, and PMDD is as you can see, this is more severe sort of PMS. It's like severe headache, extreme cramping, sleeplessness, breast tenderness, difficulty in concentration, which is a severe form of PMDD. It can go into the first and second day of periods. And PMS, as everybody knows, is different from dysmenorrhea, but it can overlap. And these are the symptoms: headache, bloating, acne, breast tenderness, sugar cravings, which is absolutely a part of the hormonal imbalance. It is not that the girl is going through something abnormal or आप उसको बोलो कि ये क्या हो रहा है. Don't dismiss her. Listen to her. Understand that this is because of hormonal fluctuation. Many of us, we say, अच्छा एक aspirin ले लो and move on. But to see and manage and support is the most important thing. There are so many things that are going on, like pelvic pain, change in appetite. There is temporary weight gain, which a lot of athletes, a lot of lifters, a lot of people, in fact, boxers, they are so particular, right? They have to maintain a certain weight in their category. So उसमें फिर weight gain अगर होता है because of the hormonal imbalance, which will need to be managed by the coaches. So all these things are around the menstrual cycle. Then comes the psychological implication, fear of not ever being free of pain. मुझे pain होने ही वाला है, मतलब ये इससे मुझे साथ में रहना ही पड़ेगा. फिर depression, poor self-image, doubts about sexuality. We feel that women are always sidelined or dismissed, compared to the males. There is gender inequality, discrimination. ट्रीटमेंट मेल एथलीट से काफी अलग हो जाती है फीमेल्स की। अच्छा, अभी प्राइमरी और डिस्मिनोरिया और सेकेंडरी डिस्मिनोरिया में डिफरेंस में पैथोलॉजी तो मैंने आपको समझा दिया। व्हाट आर द सिम्टम्स, व्हाट आर द साइंस, कि किस चीज में आपको लगना चाहिए कि ये रियली डॉक्टर के पास जाना पड़ेगा और इसके लिए सीरियस सोल्यूशन ढूंढना पड़ेगा। सेकेंडरी में वी नो दैट देयर इज सम काइंड ऑफ अ फाइब्रॉइड और कोई ग्रोथ हुआ है, तो ये केसेस बहुत लेटर स्टेज में पता चलती है। एडोलेसेंट गर्ल्स में यूजुअली, यंग गर्ल्स में प्राइमरी ही होता है। मेनी टाइम्स periods are normal and suddenly she starts getting pain during periods. That could be a sign के पहले अगर प्रॉब्लम फ्री थे periods, तो अगर अभी थोड़ा कॉम्प्लिकेट हो रहा है या पेन ज्यादा हो रहा है, उसका मतलब कि कोई सेकेंडरी कॉज हुआ है, कोई इन्फेक्शन या फाइब्रॉइड। अगर पेनफुल मोशंस हो रहे हैं, पेनफुल इंटरकोर्स, और इट कैन बी एक साइड पे हो रहा है, ओवरऑल पेन नहीं है एब्डोमेन में, या एक ही साइड पे अगर हो रहा है, तो मतलब एक साइड का कोई ट्यूमर है, या एक साइड पे ओवेरियन इन्फेक्शन हो गया है, या ट्यूबल इन्फेक्शन हो गया है। और पेन, प्राइमरी का जो पेन होता है वो फर्स्ट, सेकेंड, मैक्स टू मैक्स थर्ड डे के बाद खत्म हो जाता है, बट इन सेकेंडरी इट गोज थ्रू आउट द साइकिल, सो रिमेंबर दैट। एंड दीज आर सम ऑफ द टेस्ट। एक तो ब्लड काउंट है, यूरिन टेस्ट है टू रूल आउट इन्फेक्शन, सोनोग्राफी में पता चल जाएगा फाइब्रॉइड है क्या है, लैप्रोस्कोपी से पता चल जाएगा कोई एडिशंस है, कोई ट्यूमर है या कोई पॉलिप है। तो ये सारे टेस्ट करने के बाद मैनेजमेंट पे अगर हम आते हैं, तो यूजुअली हमने देखा है कि नॉट ओनली all of us, athletes as well as coaches है या parents है, even the healthcare providers make sure that they know what they are telling the patient or telling young 24, 25, 26-year-old good athletes. You know, you don't tell them that if you get married or if you get pregnant, your problem will be solved. Let's not make that mistake as giving advice. So अगर कोई डॉक्टर आपको ऐसे बोलता है कि please run away from that doctor then. So I am very clear about that you know, the correct advice and the correct support is required for the athlete, because the athlete wants to win, the athlete wants to compete, the athlete wants to play. इसीलिए हम आज ये सेमिनार कर रहे हैं, I believe, and to give this kind of an advice is very, very, very discouraging. So we need to focus on the right kind of treatment, support and management with pills. Pills में क्या है कि we need to understand nothing comes without side effects. But we need to make sure कि कौन सा treatment कौन से individual को suit करता है. तो ये सारा treatment, if you can see, I hope this is clear to you all. This slide is clear, Mansi? Yeah. Hormonal treatment जो है उसमें OC pills है, progesterone pills है, injections भी आते हैं, और danazol which is a male hormone, and naphorelin spray, nasal spray भी आता है. ये सारा treatment under a gynec's advice and under supervision ही लेना पड़ेगा. और बाकी सारे जो नॉर्मल होम रेमेडीज है वो भी काफी हद तक you know, they are quite effective. Heat application, massages, and of course there are other treatments like surgical treatment even for primary dysmenorrhea, and which is also paracervical block. तो उसमें क्या होता है कि अगर cervix के साइड पे जो दो नर्व्स होती है वहां पे एक इंजेक्शन दे देते हैं और उसमें पेन थोड़ा सा हो सकता है, but again it is no guarantee that the pain will never come back. These are all things which are done in very severe primary dysmenorrhea. Then the other option is intrauterine device, मतलब copper T जो हम बोलते हैं, it does not contain copper, it contains progesterone, which is a hormone which reduces the pain. So these are some of the options. I think somebody is unmuted. We'll have to mute that person. और आप सबको ये जो ट्रीटमेंट है, which is I think everybody knows about this, Meftal spas. Yes, no? Okay. तो मैं थोड़ा सा detail इसमें I will just brush up. Now, Meftal, what is it? It is a non-steroidal anti-inflammatory. Now, NSAIDs also have side effects, lekin it is extremely effective and it is very specific to the problem of menstrual cramps. And that is why mefenamic acid is given in menstrual cramps. Meftal hai, Dismen hai, or Ponstan hai. If you see, I have mentioned in the abbreviation mefenamic acid and dicyclomine. So these are the two drugs in this particular drug formula. Trapic MF भी हम very commonly देते हैं. इसमें है tropinamic acid. इसमें the only difference is mefenamic is an NSAID which reduces the inflammation, and trapic which is going to cause delay in the blood clot breakdown. So mainly a lot of blood clots can cause this problem. Mefenamic acid affects the prostaglandin. So all these different combinations have different effects. There is another effect that we want is to relax the uterus. Uterus को क्या हो गया है? गर्भाशय एकदम ऐसे tight हो गया है, एकदम ऐसे contract कर रहा है. तो एक और choice है Drotin, जो antispasmodic है, जो spasm में चला गया है, right? So उसको कैसे हम relax करें? तो इसलिए हमें we give what we call it as tramadol or Drotin. But again, a lot of, individual पे क्या suit करता है वो हमें देखना पड़ेगा. So a lot of other NSAIDs like Brufen है, Combiflam है, all these other different options are available. Now coming to hormones, right? Hormones are given commonly. अगर एक बहुत important tournament आ रही है, like I see a lot of 2-3 parents are over here asking if I think they have their children, the girls are playing badminton, young girls. So अगर वो tournament में जा रही है and you are expecting periods around that tournament, how will you want to push the periods, postpone the periods or prepone the periods, right? Now इसके लिए भी available है solutions. Pills are available. I'm sure you all are aware of these Primolute, and it's very common. It's commonly given by gynacs to postpone and prepone. But again, more than 3 to 4 times very quickly in 3 to 4 months, if you're playing with the hormones, you're playing with the pituitary hormones, तो इतना frequently नहीं देना चाहिए. Once in a while, once in 6 months, if you're pushing the periods, that's fine. How is it given? Primolute N, 5 milligram, 3 times a day. One is, chalo, we want to prepone the period. The period is going to come on, say, 1st of March, right? So you have to start Primolute N 10 days prior. Okay. And if you want preponement, say by 25th, so you have to stop at least, you have to start at least 15 days prior and stop 3 days before you want the period. Suppose it's coming on the 1st of March and you want it on the 25th of February. So you stop it on 21st or 22nd of February, and within 3 days you will get the periods. That's how you prepone the periods. How do you postpone the periods or you push the periods? 1st March को period आने वाला है, आपका एक important match है. So you want to push the periods. So what you can do is start on the 21st of, say, February, continue up to the 5th of March till the time the tournament is over, right? I hope I'm not too fast, right?
No, at least for not for me, but in case
no,
very
clear, very clear. Thank
if I'm going too fast, preponing and postponing, a lot of female athletes, they use these pills for preponing. If you have any questions, please put it in the chat box and I'll again brush up this particular topic. No problem. So postpone agar karna hai period ko, so again, Primolute N, very commonly taken. And you can postpone it up to, say, 5th of March, as I said, and stop it, and within 3 days you will get your periods. Now this acts by creating thinning of the uterine lining. अगर यूट्राइन का लाइनिंग जो है वो थिन हो जाता है तो वो पीरियड आएगा ही नहीं, right? And that is how when you stop it, again the lining becomes ripe, and when you stop after 3 days, the period will start. Now इसमें भी side effects कभी कभी rarely दिखने को मिलते हैं. Mostly side effect नहीं दिखते हैं because it is taken regularly, properly, in the correct dose at the correct time every day. No side effects are seen. Very rarely breakthrough bleeding, कभी कभी spotting होता है. Breakthrough bleeding मतलब spotting. कभी कभी mood changes भी आ सकते हैं, कभी कभी acne हो सकता है, और long term अगर लेते रहे तो some cardiac issue, thrombotic issue हो सकता है. So take it very, very carefully, and again under the supervision of a gynaec. बहुत rare है ये side effects. The only thing is कभी समझो if you have an infection while you're taking these Primolute N pills and you have diarrhea, तो उसका जो Primolute N का जो absorption है वो reduce हो जाता है, तो उसमें फिर breakthrough bleeding आ सकता है. So be very much in touch with your gynaec and take the correct advice. So Primolute N, the side effects and the duration and how to take it, I have mentioned. Another way of postponing the periods is, suppose the athlete is taking some kind of pills, monthly pills जो है, अगर athlete ले रहा है for any reason, then she can continue to take the next pack of the pills without a break. Break के टाइप period आता है, अगर break आप ना दो, 21 days की जो pills होती है उसका break आप ना दो and start the next pack immediately, so again you can postpone the period. As soon as you stop the pills, then you will get the periods within 2-3 days. ये और एक device है, it is intrauterine device which is used for contraceptive. It can also be used to reduce excess bleeding, menorrhagia बोलते हैं उसको, and it helps in reducing period pain. These are various options. There is acupuncture, there is food supplements, there is changes in the diets. So इसमें problem क्या है कि let's stick to simple measures like medicines है, NSAIDs, anti-inflammatory Meftal है, where there are no major side effects. Try to avoid unnecessary excess long duration of medicines. Now, if you are repeatedly postponing your periods, मैंने आपको अभी भी 2 slides के पहले मैंने आपको बताया कि it is not advisable to take it for a long period. What are you trying to do? If you're taking OC pills, there is loss of ovulation. Many athletes, swimmers hai, many athletes who are playing very frequently and many tournaments are there, they don't want periods at all, right? उनको बिल्कुल periods नहीं चाहिए. अगर periods नहीं चाहिए उसका मतलब ovulation भी नहीं होगा. Okay, but we need to realize that ovulation is protective towards the female. Okay, loss of ovulation है, which causes what? It causes lack of estrogen, lack of progesterone, lack of LH, FSH, and these are all good hormones. If you're playing around with the hormones too much for too long, then it will cause all these problems like decrease in the bone minerals, musculoskeletal injuries, immunity can reduce, decrease protein synthesis, and some GI and cardiac issues can also happen. Now, there are some questions, there is 1 or 2 questions which were, what should we use? Pads during period pain is better, tampon is better, cup is better. So period pain is not related to what is being used during periods. Period pain is because of the uterine contraction and the hormonal problem and all these capillary constriction which is happening. But the discomfort, okay, the discomfort that you have while playing any particular game or sport, the discomfort, if you want to get rid of it, tampons and cups are definitely better. Now, tampons may you have to be very careful. You have to make sure that you're removing it within 4 to 6 hours, and depending upon your flow, overnight tampon ka rakhna is not advisable. इनफैक्ट टैम्पॉन को अगर ज्यादा टाइम तक रखो इन्फेक्शन के चांसेस होते हैं और वो पीरियड पेन को बढ़ा सकते हैं, right? And cups में menstrual cups are really now, I think a lot of people are getting more and more aware of the eco-friendliness or what we call a sustainability of menstrual cups. Now, tampons and pads are very bad for the environment. They are non-biodegradable, as we all know, unless we are doing cloth pads, which is again being, nowadays a lot of new companies have started that. Anyway, we are not going into those details, but yes, pads are equally fine. There are pros and cons of pads. It's just that when you are in tournaments or sports, the hygiene facilities, sanitation facilities कैसे है, वो आपको देखने हैं. अगर dustbin नहीं है, तो where will you dispose the pads? So tampons, you can just flush. You can, not do that with the menstrual pads. Now, cups are really a blessing. Cups are reusable. You can wash them. It's very easy to use. It can be used by swimmers. It's just, you just don't feel it at all. And it just reduces the discomfort much more than even tampons. So these must be tried by the female athletes. Now in diet, we've already discussed the medicines that can be used, but diet, magnesium as well as thiamine, B1, are known to help and to some extent reduce the inflammation which is causing period pain. Now, magnesium is found in a lot of foods like pumpkin seeds, green leafy vegetables, and it reduces by relaxing the uterine muscles, by improving the blood flow, and it curbs the prostaglandin, which causes the period pain. It should be taken under a doctor's supervision, 320 milligrams for women. Usually there are no side effects, except there may be some loose motions or excessive frequency in motions. Thiamine B1 should also be advised. What is the time? Yeah, we are just finishing now. This is heat pad. And another new thing, which is a brand called, I think, I don't want to name the brand, but you can see it is what is known as transcutaneous electrical nerve stimulation, TENS technology. It's a device which reduces the pain, and there is no medicines or there is no side effects in this. So it completely, it's based on transmission of the the waves, and it just helps in temporary as long as you're using it. Now, the other approach is, of course, your diet and sleep and rest. A lot of people try to underestimate that, you need to push yourself. A lot of people in the past, what I've seen, like I've spoken to a lot of athletes who are now in their 30s or 40s and who are at their prime, female athletes. When I speak to them, they said, oh, we never thought too much about our periods. We just played, right? So yes, it used to be something that was never discussed. And in that process, a lot of athletes which really were suffering because of the excruciating pain that they were going through got completely sidelined. So of course, it is important to discuss. In fact, one of the top golfers who just represented India, I think I spoke to her about a month back, and she had excruciating pain in the first 2 days, and she has to postpone her periods. Otherwise, it is going to compromise her delivery and her execution of and her game. So she needs a holistic approach, which is diet, which is her sleep, her rest, and her recovery. In diet, it is so important that she's taking complex carbs. Now, in that phase of your menstrual cycle, which is the recovery phase, which is also the follicular phase, which is brilliant to do the maximum as your third day and the fourth day of the period is getting over, you immediately start to feel energetic and you need to get back into the intense training. So you need to make sure that you have your carbs and your lean protein. You need to be very careful about caffeine, alcohol, getting the right practices of exercise like yoga, meditation, vitamin D, and going out into the sun as well. So I'm sure this can be covered more by a nutritionist, right? And of course, when it comes to period pain, there is another common thing. UTI sometimes can be mistaken for period pain. Mistaken. So it is so important to understand that there is burning and pain at the same time. If there is burning, if there is itching, please look out for an infection. It could be candidiasis, it could be urinary tract infection. So there is some urge to urinate, even when the bladder is empty. Then, there is lower abdominal pain, there is fever. So make sure that you're drinking plenty of water, you get your CBC, your urine testing done, drink cranberry juice, avoid sodas, coffee, tea, keeping the area clean. Sanitation facilities usually do not cause any such problems because you're not really sitting on dirty surfaces. So just be very careful. There are a lot of other brands like P-Safe and all that, which is available where, if you don't have good sanitation facilities. Wearing very tight clothes in female athletes is seen to cause this. Use very good athlete material, breathable material. Avoid synthetics. There are other questions like, this one particular, I had regular periods for 2 years. Now my periods are light. I'm experiencing more pain because I've been training hard. So exercise, we all say to normal regular girls that you need to exercise so that your periods you're able to deal with the cramps much better, because you will get a release of endorphins, which is like the human morphine. But there may be other issues which is actually causing the pain. So even exercise is not helping her. But also another thing which is seen is that if there is excess exercise, there is excess muscle fatigue. Even that can lead to excess period pain. There were some other questions like, there is discharge along with period pain, along with irregular cycles. So again, this could be a sign of polyp or any kind of infection. There were quite a few questions on how to plan workouts during periods, and there were questions on PCOD and amenorrhea, which we are not covering in this. PCOD can be a separate topic in itself, which we can cover, and amenorrhea as well. Now, training in the 2 phases is what I would like to just very quickly get into. So we know that there are 4 phases of the menstrual cycle: the menstrual phase, when the periods are on, then the follicular phase, then the ovulatory phase, which is the ovulation taking place, and the last one is the luteal phase, just before the periods. So let's talk about the follicular and the luteal phase. जब भी period आता है, तो already आपका follicular phase शुरू हो जाता है, क्योंकि uterine lining shed हो रही है और जो अंडाशय में जो एग है वो अभी फॉलिकल के साइज का है, एकदम छोटा सा है. तो ये जो टाइम है, अगर पीरियड पेन नहीं है तो एक्सरसाइज कैसे करें? सेकेंड डे ऑफ द पीरियड से हाई इंटेंसिटी वर्कआउट चालू कर सकते हैं अगर पीरियड पेन नहीं है तो. अगर सिवियर पीरियड पेन है, मॉडरेट पीरियड पेन है, तो थोड़ा सा रेस्ट और रिकवरी थोड़ा और देना पड़ेगा. ये वापस इंडिविजुअलाइज करना पड़ेगा ट्रेनिंग. High intensity workouts, resistance training, building muscle, and also जो iron requirements है in the first phase, वो increase हो जाती है. एक तो bleeding हो रहा है, menstrual phase चालू है, right? तो blood flow में आपका iron loss हो रहा है थोड़ा बहुत. तो वो टाइम पे जो डाइट है वो आयरन रिच डाइट होना चाहिए. मीट, चिकन, एग्स, होल ग्रेन्स, इफ यू आर वेजिटेरियन, बीन्स, पीस, चिकपीस, लेंटिल्स. जो दाल्स है जिसमें भी आयरन ज्यादा है, ग्रीन वेजिटेबल्स है, हरी सब्जियां है. फिश में भी आपको ओमेगा 3 मिलेगा जो आपका इन्फ्लेमेशन कम करेगा. तो ये इंपॉर्टेंट है फॉलिकुलर फेज में. जस्ट 1 or 2 days आफ्टर द पीरियड्स. And lots of water. Now, after the ovulation phase जो है, वो है luteal phase, जो last 15 days of the cycle है. समझो last 14 to 16 days. उसमें low intensity strengthening workouts कर सकते हैं और push कर सकते हैं athlete को, but फिर भी body को सुनना जरूरी है. You have to listen to the body. You can fuel up with carbohydrates before and during the workouts. Again, during these weeks, it is going to happen that the athlete is going to feel hungrier, and this is normal. कभी-कभी ज़्यादा calories and ज़्यादा weight gain हो सकता है, जैसे मैंने अभी mention किया था. ये जो phase है, इसमें water कभी-कभी हम लोग कम पीने, फीमेल एथलीट्स कम पीते हैं, तो वो अवेयरनेस चाहिए कि उनको ज्यादा पानी पीना चाहिए. Keep water at hand during this particular phase, which is the luteal phase. These exercises we know, जो stretching है, yoga के poses है, if you observe, some of them will be very good period pain के time पे, first and second day पे. I would like to actually end this session with questions. Not really, these are conversations which have started on forums like this. We need to answer over a period of time, and we need to learn from our athletes. How can academies, parents design a period-friendly work environment? How can athletes and coaches use cycle awareness as a superpower in their work? जैसे मैंने आपको बताया, जो training है follicular phase में और luteal phase में, दो phases में, हम कैसे maximum best training करा सकते हैं तो athlete another level तक पहुंच सके. अगर same training throughout the month रखेंगे, तो it is not fair to the female athlete because she is going through a lot of these kind of changes. तो वो conversations अभी हो रही है, काफी सारी studies हो रही है. In fact, real conversations have started only from 2015, 2016. अगर आपको पता है, ये जो Olympics हुए टोक्यो में, for the first time in history, 49% participation was from females. For the first time in the history. So, ये सारी conversations बहुत ही important हो गई है. Now, period के time leave लेना, is it important? Is it really necessary? Now, it is a controversial idea, but it can be a game changer. अगर आपको fibroids या और endometriosis के problems है, अगर तो definitely आपको leave लेना चाहिए. लेकिन ये थोड़ा सा unexpected problems भी create कर सकते हैं, क्योंकि किसी को भी, whether it is a female or a male, nobody should take advantage of this particular leeway. So I would just like to leave it at that, and kudos to Simply Periods for creating a space to speak openly about menstruation and represent it in such creative ways and bringing all the stakeholders together for the female athlete. Hope you enjoyed this discussion with me, and I would just like to stop the share screen, and we can even unmute and ask questions now.
So it was really great talk, and most of the questions which we saw in the registration, I think so you know tried to cover it through the demonstration, but now I know we are like at 6:55, so we can start questions. So all the participants who have any questions can go. We can take like at least 4 to 5 questions quickly, and we'll end around 7:05, 7:10. Okay, start. Please, please go. You can, raise a hand, unmute yourself. You can go
put on their
with your
videos
questions.
and we can have conversations. Any particular experiences that anybody wants to share? I would be very happy to even learn from everyone. What are their experiences? I'm not seeing any questions, so I've tried to answer as much as possible.
Any questions? You can type also in the chat box. That is also fine.
So, ma'am, I had a question. Like you were mentioning that with the training with the phases is something that athletes should consider. So, in the sessions that you have been conducting with athletes, have you seen any have you experienced any athletes actually using those changed training methodologies and how it has influenced them?
These are actually just conversations which are starting.
Right.
Actually, yahan pe, I don't think really there is any phases ke hisab se there is not much of training happening. It is general training happening. Lekin specifically jo athletes are training at a, sorry, I'm again talking totally mixed up in Hindi and English.
No problem, ma'am.
So,
Koi dikkat nahi hai, not at all.
I think we definitely need to work more in that direction. Okay. And creating modules, first of all, SNC coaches need to be going through a certain course to understand how they can modify the training for their female athletes. So, जैसे मैंने आपको बोला कि follicular phase और luteal phase, ये दोनों phases में जो hormonal fluctuations है, उसमें weight fluctuations भी होते हैं, water retention होता है in the second half of the cycle, right? So ये सब दिमाग में रखते हुए, I think we should make sure that we do make some minor changes in their training, and all these coaches can come together and, you know, have discussions with their own people who are masters in, you know, creating their workout plans, their SNC plans, their strengthening plans. ये बहुत important हो जाता है. So जो coach है, उनको ये सब करना चाहिए. From my side, as a gynac or any other gynac can provide what are the, you know, the physiological changes. We can provide that to the coach, and then the coach can design these workouts. In our program in Clinetics, we have seen that till the age of puberty, girls and boys, we give the absolute same training. There is no difference. And then we have seen that after girls reach puberty, we need to change the training a little bit, because the girls are shooting up faster, right? Just pre-puberty or around puberty ke time, they definitely need to focus a lot more on strengthening, because that's where the bone mass is going to increase. In the first, from 11 years to 20 years is the maximum absorption and, you know, increase in the bone mass in any female. So you need to focus on a lot of strengthening workouts, resistance workouts. और ये awareness बहुत कम है अभी भी. I think coaches में वही जो strengthening जो ज्यादा करना चाहिए in female athletes, वो नहीं हो रहा है. Just cardio, just running is not enough. So focus a lot more on strengthening, muscular strengthening. वो workout plan में include करना बहुत जरूरी है.
Thank you so much.
In fact, that there was a question, Mansi, that if the girl's core muscle strength is good, then the period pain will reduce. So I would just like to say it's a very good question, because see, first of all, period pain is not related to any core strength or anything. Period pain is because of uterine pain, right? But at the same time, if the core strength is good, you know, the athlete is going to recover very fast from any kind of setback for 1 or 2 days because of the period pain. So I think in a way, I think, you know, strengthening your core and all that is definitely going to help the females. I think that strengthening is something that all coaches must include for their female athletes.
Of course, that was good. Even while one of the workshop, one of the coach had said, you know, if should we give, you know, any app training, core training during the periods or not. So I think so it would be individual question.
Yeah, so during the periods, if the girl is not having any pain, a lot of girls don't suffer from period pain. It's fine to continue the same kind of workouts, right? The rest and recovery is advised. Yoga and meditation is advised during periods for those very severe period pains and moderate to severe period pains. So, I mean, but at the same time, there's another study which has been done comparing normal non-athlete girls to female athletes. whether who's getting more period pain. And the female athletes had more period pain. So these are some small studies that you come across here and there. And there is a lot more research required. Now you can guess why, because what happens is female athletes, they go stress themselves physically, as well as there's a lot of mental stress. So there are various reasons why that period pain is seen a little more in female athletes. There's muscle exhaustion also. It could be because of that. It could be more cervical stenosis. We don't know. So I think a combination of all the research which is being done, and then a conclusion can be. I think a lot of water electrolyte imbalance is also seen. And because of that, there would be cramps which are increased in the thighs or during periods, pre-periods. All of this is definitely to be kept in mind by the coaches and by the parents.
That
You
that
had
was
right
great.
in the beginning, you had mentioned about making a note of everything. So my daughter, ever since she started using a period tracking software called Flow or something, when she's able to write what she's feeling in that, and that software seems to be giving some feedback, she seems to feel much better about everything. I don't know how that works, but
This is amazing. I think hats off to you and whoever has suggested this to your daughter. It is so important to note what she is going through and what she is feeling. I think every female athlete should make a journaling habit if they really want to succeed. I think there is a whole holistic approach that can be had for them. Amazing.
If we want, we are
just
almost
one
towards
quick
the-
question.
Yeah.
Whenever through our childhood, we were always told that periods is a mental thing. If you keep thinking about it, you won't get your periods. Meaning that kind of thing was always there. To what extent is it controlled by moods, or is it the mood because of the periods, which seems to be now with my girls?
So this mood is also connected to the hormones. It is all a complex phenomenon, and there are two sides to it. Like even we've seen in our own personal experiences how we have been brought up. For example, just ignore it. Right now, I'm actually wondering whether we should focus a lot more on this period issue, or whether we should just say that, okay, ignore it and get back to work. So we are at that stage right now. And I think these are just discussions that will show us the way. And, it is important to be heard, but, you need to hear them out, how they are feeling. Because today's generation is slightly different. Today's female athletes are exposed to many other things and many other pressures. There is a lot of pressure to perform, and do well in everything. Whether you are an athlete, you need to also do well in academics. So I think it's a lot. Let's be nice to them. I think they're trying their best. And all these mood changes and all that, yes, we need to address. But let's not encourage too much of it also. Because we have also gone through these tough, times. And, we've also kind of dealt with it. There are all kinds of ideas that, you should talk about it, you should make a noise about it. But in my very personal opinion, I think everyone has their own individual way of dealing. And I think if she wants to pour her heart out, you should hear her out, because this generation is definitely different.
Thank you.
That was a great answer. Yeah. Any more questions? If anyone wants to ask, have like 2 minutes. Does anyone have more questions? There are no questions. I will just stop recording.
Yeah.
Just a second.